Okay, I'm Sheriff Quadri. Let's bring you our next next program on the lineup for today being a 6:30. And you know, if you've been a fan of Nigeria Info and you know what we do at about this time, you're aware that we talk health, and we have decided to again continue in our normal fashion, our normal tradition of bringing you practical health tips with Dr. Avon. I've got a Dr. Avon in here right now, but before I do that, let me have you know that Dr. Avon is they are the sponsors of Practical Health Tips with Dr. Avon, and please know that you can always reach out to them, whatever issues, concerns about your health, or even about the program at all. If you got inquiries, please follow them on their social media platforms on Twitter, Instagram, and Facebook at Avon HMO. On those two, on all the platforms, Facebook, Twitter, which is X now, and Instagram. You can also shoot them an email, practicaltips@avonhealthcare.com. That's practical tips in one word at avonhealthcare.com. All right. Okay. Now, today on the show, we have a topic for you. The topic is Screen, Protect, Defeat, the Cervical Cancer Playbook for Women. And I'm not doing this because I do not know jack about this conversation. That's why I have Dr. Avon in the person of Dr. Oluwaseun Adefihan in the studios with me today. Dr. Adefihan, good evening to you and thank you for joining us.
Good evening, Sheriff. Thank you for having me.
Oh, wow. See voice, Oluwa, Jesu Bami. How are you?
Fine, thank you.
Okay, nice. Let me introduce you properly to our listener at home. Dr. Adefihan is a medical officer with over 5 years' experience. She is committed to making healthcare accessible to all. She's a graduate of the College of Medicine, University of Lagos. She's actively involved in medical outreaches that help to bridge health information gaps. Currently, Dr. Adefihan is a practicing medical officer at Avon Medical Practice. She helps individuals navigate their health concerns and make informed decisions. And we are glad to have Dr. Adefihan in the studio here with us. Let's talk about some facts on cervical cancer. Cervical cancer is one of the most preventable forms of cancers. Human papilloma HPV is the primary cause of cervical cancer, and it is preventable through vaccination. You should know that regular screening such as pap smears and HPV tests can detect precancerous changes, significantly improving survival rates. And also, please note that early detection ensures up to a 90% chance of successful treatment. And yes, this is very vital. Cultural stigma, very, very vital. Cultural stigma and lack of awareness are significant barriers to prevention and treatment. I just thought to share those interesting facts with you before I engage Dr. Adefihan. Adefihan, let's start this way, right? What is cervical cancer, and why is it a critical health concern for women, especially in Nigeria?
Okay, first of all, I'd like to explain what the cervix is.
Okay.
The cervix is sometimes called the neck of the womb. It's the passage into the womb from the vagina. Now, cervical cancer is cancer of the cervix, is one of the commonest cancers that affects women globally. It's the fourth most common cancer worldwide. In 2022, it was said that cervical cancer took the lives of about 350,000 women, which is quite a significant number.
Oh.
So this is why everyone needs to be aware of cervical cancer.
That number, is it a Nigerian number?
No, it's a WHO number.
It's a WHO number?
Yes.
Oh, wow. What are the primary causes of cervical cancer, and what are the risk factors associated with cervical cancer?
So studies have shown that 99% of all cervical cancers are associated with the human papilloma virus, which makes it the most important cause of cervical cancer. So the human papilloma virus is a sexually transmitted infection. It can be gotten from oral sex, vaginal sex, anal sex, or even skin-to-skin genital contact. This infection is very common. Normally, it's the body clears it in many situations.
Okay.
However, sometimes the infection can become persistent, which can lead to cervical cancer.
Is that the only risk factor?
There are other risk factors. That's just the most. That's
the prominent
primary,
ones.
Yes. Other risk factors include smoking. So studies have shown that the tobacco in cigarettes can change the cells in the cervix, make them abnormal, and lead to cervical cancer. Those who have weakened immune systems as well can have cervical cancer because it increases their risk of having the human papillomavirus infection, and because their immune systems are weakened, they have difficulty clearing the infection, and which can make it persistent, leading to cervical cancer.
Interesting. How about alcohol? Does it play any role?
No. There's no evidence concerning alcohol.
Watching too much this thing. What's that movie that Zainab likes too much like this? Zainab, what's that movie that you like too much? Telemundo. It doesn't cause it.
No.
Okay. Well, let's talk about screening. How do screenings like pap smears, HPV tests help in early detection?
All right.
And maybe prevention as well.
Okay. So cervical cancer, it develops slowly. Okay, it takes about 15 to 20 years to finally develop into cancer. Now, it becomes precancerous cells before it becomes cancer.
Okay.
Now, the screening helps to detect these cells when they're still precancerous. Okay, so that's where the pap smear comes in and the HPV testing. So the pap smear helps to check for abnormal cells in the cervix.
Okay.
So when they're identified, these abnormal cells can be treated before it becomes cancer.
Okay.
Now, for the HPV testing, it's testing for the infection itself in people. So it tests it checks if there has been an infection.
Right.
It's not as common in Nigeria as the pap smear due to costs.
Okay.
But the pap smear is very available everywhere. We also do it at Avon medical practice where I work. So
how often should one get tested?
It's advised that every woman gets tested every 3 years.
Every 3 years.
So women above the age of 25.
Oh yeah, I was going to ask that. Yeah.
Can get tested. So if the cells come out normal, then you can do it in 3 years. But of course, if it's abnormal, you might have to do other tests.
If you haven't been sexually active, should you get tested as well?
No, because we know it's a sexually transmitted infection.
Okay.
So if you haven't been sexually active, there's a reduced chance of having infection.
Does that mean that you can't have it if you're not sexually active?
So it depends. It can be contacted through genital contact.
Okay.
So if you had some maybe foreplay and not sex, it's possible to be transmitted.
Oh, all right. What is the HPV vaccine? Talk to us about that.
So the HPV vaccine helps to protect against the human papillomavirus, which is the HPV, and which is the primary cause of the cervical cancer. So vaccinations are encouraged in girls between the age of 9 to 14. Actually, it has been included in our national immunization program in Nigeria.
Okay.
So girls between the age of 9 to 14 can get the vaccines for free in any government facility.
So it's accessible. People
accessible.
Can access it in Nigeria.
Yes. It's very accessible. Also, girls above 15, that's above 14, can get it in private centers or government centers, but they will have to pay out of pocket.
Oh, all right. How about those who have enrolled on Avon HMO platform? Can they have access to it?
Oh, yes, they can.
Okay, so it covers it.
It covers it, and they can come to Avon medical practice to get the vaccines.
Oh, fantastic. If you'd like to, hear more and know more about how you can do this, if you have a girl child, for instance, please shoot them an email, practicaltips@avonhealthcare.com. If you have more questions on the vaccine, practicaltips@avonhealthcare.com. That's where you can go. Let me also remind you that next week is a trivia episode of this show, so which means that you can win gifts, you can win airtime. All you need to do is just answer a couple, trivial questions, and then you'll be able to go away with something really nice, courtesy Avon HMO. Now, Dr. Adefihan, let's move on a little bit. One other important aspect of this conversation is stigma. How can we address this?
I think the most important way to reduce the stigma is to normalize conversations like this. Normalize talking about cervical cancer, normalize talking about female health. can normalize this by having discussions in schools among family members. As when people hear it and hear it often, it will reduce the stigma and embarrassment concerned with the topic.
Aside vaccination, though, what other steps can women take to prevent cervical cancer? And I'd like to also add that, what can they do to maintain overall reproductive health?
All right, so we mentioned screening, which is the pap smear. So aside vaccination, pap smear is very important because it helps detect changes early and helps us treat it before it becomes cancer. Now, women can improve their general health by also practicing safe sex. We know that the human papillomavirus is transmitted through sexual intercourse. So practicing safe sex with condoms can reduce the risk of infection.
Indeed. How about overall maintaining overall good health?
Well, diet and exercise cannot be overemphasized. Although it's not directly related to cervical cancer, it helps to maintain general health and well-being.
I mean, if you ask most people these days, they will tell you that they are too busy. I don't get time to go to the gym. I can't even, all of these things. As a medical doctor, could you again emphasize the need for people to be active, and what are those conditions that being inactive for so long can cause in one's health?
Well, I know Lagos is quite busy from work to traffic, so it can be difficult to exercise.
It's by situation. It's not that they love it.
So the best thing to do is to try to exercise within your environment. So if you're at work, you can decide to take the stairs instead of taking the elevator. This will help. Then watching your diet, reducing soda and sugary drinks can also help.
Sugar? Let's talk about myths, because I know that people, I've seen a situation whereby, God rest her soul, she came down with, this lady came down with breast cancer, and before you know it, the husband and the relatives started saying that it was because she was cheating. That's why the god of their village struck her with breast cancer. And it was so sad, because to me that depicted a picture of ignorance to the highest level. And I'm glad that we're having this conversation, because before you know it, someone would have, God forbid, cervical cancer, and then they would attribute it to something else. Are there any myths whatsoever about cervical cancer that we need to dispel right now?
Oh yes, I've also heard people say cervical cancer is associated with people who are promiscuous. So that's wrong, because even if the HPV virus, that's the human papillomavirus, is contacted through multiple sexual partners, or multiple sexual partners, that increases the risk of contacting the infection. Anyone who is sexually active can have the infection, regardless of the number of sexual partners they have. So it's not associated with promiscuity. Anybody can have the infection. Then I've also heard some people say that those who have been vaccinated do not need to have their routine pap smears. So this is also wrong, because the vaccines don't cover, or the available vaccine, which is Cervarix, which that's the most common one, doesn't cover for all the types of HPV, that's the human papillomavirus, which causes the cancer. So people who have gotten the vaccine still have to do their routine pap smears to avoid cervical cancer.
Brilliant. What will be your parting shot, especially to ladies, women, mothers listening right now?
All right. So I'll advise every mother to get their daughters vaccinated, doctors between ages 9 to 15 or even older. We recommend vaccinations to children or ladies from 9 to 15 and 15 to 26. Now, every woman who is sexually active should also get a pap smear done to avoid cervical cancer.
You know what, Dr. Oluwaseun Adefihan, thank you so much for joining us on Practical Health Tips with Dr. Avon today. It's been a pleasure having you.
Thank you.
Let's also remind our listeners that next week is our trivia episode. Please get ready for it. You have to listen to this show and the one before this show, because questions will be extracted from the 2 episodes next week. Then you can win 1 or 2 things, for yourself. Many thanks to the producer of the show, Zainab. And I also would like to say that you can reach out to Avon HMO across their social media platforms on Twitter, Instagram, and Facebook. Their handle is at Avon HMO, AVON HMO on Twitter, that's X, Instagram, and Facebook. You can also shoot them an email on practicaltips@avonhealthcare.com. I'm Sheriff Quadri. Our next program comes up shortly.